Alright, so hi Jason. I know you from medicine and a lot of stuff, and I understand your surgical rotation is going to be coming up shortly. How long away is that for you now?
It's probably about another 3 weeks away.
Cool. So I'm currently doing the surgical term at the moment.
Cool.
And what I've found really useful in terms of understanding what's going on in surgeries, as well as asking appropriate questions and obviously being able to answer the right questions, is knowing the abdominal anatomy, essentially, especially like all the blood vessels, the digestive circulation, as well as specifically the renal stuff that I'm doing now. And it's really useful to know sort of what they're doing in the process, what you can and can't do in certain abdominal compartments and stuff like that. So what I'm planning on teaching you in this session is the anatomy, first of all. I'm going to take you through the anatomy. I want you to be able to come away from this session by being able to draw it. But also I'm going to apply that to some of the CT things you need to know. So CT visualization and understanding the different phases of the so-called CT IVU phases that I used in the renal surgeries that I've been learning about. So what do you remember at the moment from your anatomy in abdomen?
Not too much, to be honest. I've never been great at anatomy, so this sounds like it would be very useful.
Alright, cool. So in the abdomen, when we talk about the organs in the abdomen and the blood supply to the digestive system and everything else, what are the main sort of organs we're thinking about?
So stomach, pancreas, spleen, liver, small intestines, large intestines.
Yep.
Kidneys.
Okay, good. So in terms of what we want to know first and foremost when we draw this to understand the anatomy in the abdomen, is you first start off with the liver, and we also usually draw the stomach as well on the side. So stomach kind of goes like this over here. And we also just draw a representation of the large colon on this side and on this side as well. So do you know what the main... I'll start with the venous system because that's probably some of the most relevant aspect in this case. Do you know what the main venous vessels I'm looking for are? And would you be able to draw where they are?
No.
Or the main ones at least?
So inferior vena cava.
Where does that run?
There.
Alright, so runs behind the liver. That's true. Yep.
And then you have the portal veins that come in from the gastric, in something like that, I think. Not too sure.
Yep.
And then you have some other vessels that I think come in from this area, the stomach and spleen and stuff that come in there.
Alright, cool. So it's good that you know that the IVC runs behind the liver, and obviously a lot of things drain into the liver as well. And once they're in the liver, where do you think they go?
Back to the heart. Back to the heart.
What about between? Because you've drawn. What is this vein that you've drawn here?
The portal.
What's this one? The portal vein. And where does that drain into?
That drains into your hepatic. I don't know.
Into your liver, right? And then from your liver, another group of vessel has to take it back to the IVC that runs behind it. Do you know what those vessels might be called?
No.
So those would be your hepatic veins as well.
Right.
So you have 3 of them. You have 3 of them. And would you be able to draw, because I'm sure you remember at this point where they might be? I'm not quite sure.
No.
All right.
Nope.
So you have your...
I don't remember much of my anatomy.
That's fine. That's absolutely fine. So you have your 3 that are here, and they pretty much drain from the liver.
Okay.
So the way that I like to think about it is essentially you've drawn this pretty well. So how I like to think of it is that you have a single fork in the middle here that splits into 2. So if I was to draw this a little bit more accurately, I would draw one that goes this way and here, and another that sort of runs across this way. Okay. So this one here is known as your. Do you happen to remember what that one might be called?
No.
Okay. So this one runs up from above, so it's called the superior mesenteric vein. In this case, because it drains sort of your colon and a lot of your small bowel. And this side here, especially, I like to always label it from the distal side. So this bit here is called your splenic vein.
And that runs under the stomach.
Yes.
Okay.
Sort of
It's
along behind the stomach. Yeah. So if it's called the splenic vein, would you be able to tell me what structure it drains?
spleen.
The spleen, really good. So this is your spleen here. Okay, good. And the other thing that sits along the vein is your pancreas. So the splenic vein is also responsible for draining your pancreas through. Well. So once you've got these two drawn, then there's another vessel, another vein that branches off the splenic over here. And then that's called your inferior mesenteric vein. So I like to think, the way I always draw it is I draw this two-pronged approach, and then you have your superior mesenteric vein on one side, your splenic on the other, but you know that your splenic isn't always the splenic, but it has also another branch called the inferior mesenteric vein.
So is this part called the splenic vein too?
This isn't called the splenic vein,
So
that's called the common hepatic vein, I believe.
That's right.
Cool. And then the other, so that's the most basic anatomy I want you to know for this bit. So if I was to extend it with some more detail, the interesting thing is that over here you have a sort of weird set of veins that sort of run in a figure eight. And the reason that they will run in a figure eight is that they drain a little bit funny. So this one exits or enters the veinage circulation earlier, but it actually sort of supplies the top portion. And this area here, it drains later, but it supplies the earlier portion of the stomach here. It's a bit strange in that way.
Okay.
And so this portion here, it's much easier to label it on this side. So this one would be called your pyloric vein, and this one here would be your coronary vein.
Right.
Veins. Right? This one drains a little bit of your esophagus as well. So the easy way to remember that is that the pyloric vein drains the pyloric sort of area of things in the stomach, and your coronary sort of relates to the heart, the crown. So it's
the kind of anastomose there.
Yeah. So these bits here, they don't actually drain anything, but it's only when they actually start be approximating to the stomach that they have all their little veins that come and drain. But they have this weird sort of 3D anatomical structure where the coronary side drains earlier, whereas the pyloric side drains later. So it has this weird sort of entrance over here.
Okay.
So and apart from that, you have. So what else do you have? So this portion of the stomach here is drained via the splenic as well. So if I was to draw just this bit here, you have the splenic that comes through. So a branch of the splenic. You don't need to know the exact name of that.
Okay.
But then on the other half, so this figure 8 structure here drains this side of the stomach, whereas this larger side has to obviously be drained by something else as well. And that comes from the superior mesenteric. So from here, you have another bridge that goes all the way across here, and you have all these little veins that come across and drain it.
Okay.
Right? And that's called your left gastroepiploic vein. Quite a complicated name, but for the purpose of...
So what was the first part? Epiploic left? What did you say?
Yes. So so this is another one of those weird veins where this side is called your left epiploic vein, and then this side is called your right epiploic vein.
Okay, yeah.
So it sort of drains into this side. Yeah. So if I was to draw it again, because it's starting to get a bit confusing at this point, so I'd like to rehash sort of the steps you take in drawing it. So how are we going for time? We're at 10 minutes. So you have your liver, you have your stomach, and then what I want you to do is do the two-pronged approach. So you have your two.
Yep.
This is your superior mesenteric. Over here you'd have your splenic vein.
Yep.
And from your splenic you have your inferior mesenteric. Right? And then from your superior mesenteric you have your left and your right epiploic veins, which run along the border of the stomach there and drain it.
Okay. So this whole thing is called the right and the left.
Yes. And they're separated by the branch off of the splenic that supplies this end.
Okay.
So I believe this side here is called the right epiploic, and this side here is called the left epiploic.
Okay.
And apart from that, you have that weird figure 8 structure that runs along here with your pyloric, and your coronary veins. And of course, the portal system drains here, and from your hepatic veins, you return back to the IVC that runs below. So the important thing here that I want to mention about the veins is that you have your kidneys right behind here. So you have your kidneys somewhere around here. So it's important to know that your kidneys drain sort of in sequence with the way that your liver drains, because they're right behind the liver. So your they join up to the inferior vena cava.
Directly.
Yeah. So in terms of contrast and the CT contrast that is used, do you know how contrast is given?
So intravenously?
Yes, really good. And do you understand anything about the sort of process of CT imaging? Do you have one CT? What types of CT there are?
Not really.
Not really. So you can either give contrast or you don't, right? So I'm sure you've heard of non-contrast CTs.
Yep.
Really quite often used in strokes and that kind of situation to visualize just the blood or any high dense areas that have a lot of calcium or anything like that. And there's also the contrast side of things. So in terms of contrast, you can divide stuff into multiple phases.
Okay.
And that depends on where the contrast is in the circulation, which makes perfect sense. So in the case of urology, neurological surgery, when you want to visualize different parts of the renal system or cancers or something like that, you often give an intravenous contrast. So would you be able to guess or have an idea of what sort of phases there might be? How you'd separate them?
Or the systolic and diastolic phase, maybe?
Close. So where would you inject it first?
Into veins.
So the first one would be called
the venous
phase. Yep. And then if it's injected into the arm, as it often is, it would return to what structure?
The heart.
Yes. And then it would be pumped to
the rest of the body.
The rest of the body. Bypassing first the lungs, and then it'll come back to the heart and be pumped to the rest of the body. Once it gets pumped into the rest of the body, what phase do you think that might be?
The arterial phase.
Arterial phase, yep. So you have first your venous phase, then you have your arterial phase, and then after the arterial phase, it supplies, and especially in this case it's important because the arterial phase will supply all the GI system, and then of course you have all these veins that drain back. So you have this portal, what is known as a portal venous phase, where you start getting a better visualization of the liver and everything. So 14 minutes of the liver and everything. And then after that, it's excreted by the kidneys. And often you can. So the important thing there is that you can judge a CT based on its phase. But also, what you can do is you can visualize different types of structures in the kidney depending on how they uptake contrast. So if something, for example, cyst, like often you need to know the difference between a cyst and a cancer. So if you're pumping contrast into the kidney, do you think a simple cyst, which is filled with just fluid and doesn't really have any vasculature, do you think it would uptake a lot of contrast or not? No. And then what about a cancer?
It would.
Why? Why do you reckon that would?
It has a big blood supply.
Big blood supply, yes, exactly. And then additionally on top of that, a more fibrous structure, once it takes up contrast, it can be quite slow to let go of that contrast. which is quite interesting because it means that the contrast often lingers in those areas longer than would otherwise occur. Good. So, yeah. What do you think how do you feel this session went?
I think I definitely have a better understanding of the anatomy. I've always had problems with anatomy, but I think I've kind of wrapped my head around it. So
Good.
Yeah.
Cool. And would you feel confident in drawing the circulation using the two-pronged approach?
Yeah, definitely.
Awesome.
For sure.
Cool. Well, thank you very much. I reckon you did really well as well. You obviously have some prior understanding from your previous learning in anatomy, but I'm pretty confident we developed that a little bit further and prepared you a little bit more for some of the questions they might ask in urology, neurosurgery rotation.
Cool. Thanks.